As far as your podcast goes, my favorite episode that I've listened to so far is when you interviewed Dr. Ben Bickman, a
Mhm.
beloved person in our space who obviously has literally written the book about insulin resistance. And, since being able to host him and host many people on the show, getting to have them define insulin resistance has been super fascinating because everybody who's come on, who's been an expert and obviously can understand it, but they understand it in a slightly different and nuanced way. And so I love collecting different answers to what is insulin resistance. But before we go there, I would love to hear about your own health story, how you got interested in geriatrics and why that eventually led you to insulin resistance as a topic. One might not kind of connect those two things immediately.
Absolutely. I don't know of another geriatric physical therapist in this online space, so I kind of feel like a lone wolf out
Right.
here. I'm representing all the PTs here. So I just loved older people growing up. I was so close to my grandparents. 8 out of 9 of our grandparents were at our wedding. We had a really special dance that was just for grandparents and parents. And that was so cool to see the hundreds of years of marriage there on the dance floor. I learned
Wow.
so many core values I think I inherited from my grandparents. And what I realized was I wanted to pay that forward. I knew the positive impact that my grandparents had on me, and they couldn't have done that if they were in ill health. You have to be alive, number one, and in good health, number two, to really be able to actively engage with your family as you grow older. And I wanted to pay it forward and help other grandparents be able to be that influence to their children and their grandchildren like mine were for me. And that's what drove me into geriatrics. It's funny, I always joke if I'm with like in a room of people in their 30s and 40s, I don't really have anything to say. Sorry. I'm so much better at talking to people in their 50s, 60s, 70s. It's always been my nature. And so I really adore that population. I think they have so much wisdom, so much insight. So it's like I'm helping you improve your health. You're just giving me gems of wisdom, and I love them so much. So what I realized in physical therapy, though, was I was working with people who were 60 and in worse health than my grandparents at age 80. And I thought, holy cow, they have, a decade of life that's going to be really crummy. Their quality of life is really poor. Their health is poor. They have had to spend down all of their assets to be able to afford healthcare. I've worked with people who had to move their home and get on Medicaid, and it's devastating. The level of heartbreak that I experienced as a geriatric physical therapist was nothing short of complete burnout. So I got totally burnt out as a geriatric physical therapist, but also a little bit bored. Like I think that boredom can sometimes lead to burnout too, because you would see the same types of people over and over and over again. We called them repeat offenders. Somebody with diabetes or heart disease, they fall or they have a medication that goes awry, or they have an acute exacerbation. They go to the hospital, they go to rehab, they go to home care, around and around and around, over and over and over. And I thought, this is ridiculous. We're spending way too much money, way too much time, way too much effort reactively treating disease. And if we could be more proactive, if we could work with these people 20 or 30 years earlier on lifestyle changes to prevent the disease in the first place, how much time would they save in not having to go to the doctor and not needing these preventative surgeries and not having to go to the pharmacy to get their prescriptions filled all the time? How much energy could they save? How much more productive could they be because they don't have to take a nap after every meal and sleep all afternoon? How much more, like how many more memories could they make with their family if they were able to physically walk around the zoo or go to the park with their grandkids? I was just plain heartbroken and burnt out. And I knew that if I was going to continue to work, I had to do it in a way that was in line with my values. And one of my values is health and being proactive. And so I started my business to really help those people that I wanted to reach earlier, because I felt like it was too little, too late, too often in geriatric physical therapy. And when I did that, that really forced me to dig deeper than what I had learned in school. Nobody wants a preventative physical therapist. Nobody thinks they need, which is fine. That's totally fine. But I had to figure out a lot of things about preventative medicine that I didn't learn in school. And all roads led back to insulin resistance. And only then, only after I had kind of left traditional PT and started this independent study, did I put all these pieces together. And I'm like, oh my gosh, this has been staring me in the face for years. And not once have I ever seen insulin resistance on a past medical history. But I did see all the symptoms of insulin resistance. You see the high blood sugar, you see the high blood pressure, you see the high triglycerides, you see the belly fat, you see the muscle wasting, you see the Alzheimer's disease and the vascular dementia and the heart attacks and the strokes, the peripheral neuropathy, the falls, but you never see insulin resistance. You see them just looking at the symptoms and treating disease in silos. You go to your cardiologist for your heart medicine and your endocrinologist for your diabetes medicine and your neurologist for your brain medicine. And it's just so disjointed and inefficient. And then I realized, holy cow, all roads lead back to insulin resistance. If we can help people live a low insulin and inflammation lifestyle, we kill the most birds with one stone. We reduce their risk for all of these insulin-related diseases. And then I'm like, okay, great. This is so obvious. It's all about insulin resistance and inflammation. What a simple thing. But the thing is, nobody knows about it. Doctors don't even really know about insulin resistance. So here I was for years talking about insulin resistance till I was blue in the face and no one really understood. Nobody really thought it was applicable to them. And then what I realized was that's because they think their problem is high blood sugar. They think their problem is high blood pressure. They think their problem is stubborn weight loss or belly fat or fatigue. And so I had to meet them where they were at and start speaking to those problems so that people understood, oh, actually high blood sugar is just a symptom. Obesity is a symptom, and the underlying cause has been high levels of inflammation and insulin. And once I fix these symptoms go away. And that has been years in the making, just to figure out, how do I communicate with people that we need to care about insulin when even their doctor doesn't care about insulin? Because look at your last blood panel, and I guarantee over 9 out of every 10 people watching this did not have a fasting insulin on their last blood panel. Doctors are looking at fasting glucose and hemoglobin A1C to determine if you're diabetic. And only then are they going to do something in the form of like writing a prescription for metformin or Januvia or whatever the latest pill is. And so my mission is to help people understand that fasting insulin can predict type 2 diabetes up to 2 decades before you're going to see the rise in glucose or A1C. And you don't need your physician's permission to check your fasting insulin. So I think we have a lot of people in this gray zone of like, well, I'm not that sick yet. Well, I'm not diabetic yet. Well, my blood sugars are still in a normal range, but we're not looking at insulin. And if we were, we would have a more sensitive marker to your metabolic health and have 10 to 20 years of a heads up, of a caution sign, of an alert, like you need to do something now instead of waiting until you have a problem and then putting a Band-Aid on it in the form of a medication.